Hello and welcome to Public Report. I'm Jackie Cullimer, your host. Today, our guest is Teri Zywicki. She is the CEO of St. A. Our issue for this segment is youth, and our topic is helping youth who age out of foster care. Teri, thank you so much for being our guest today.
Thank you for having me, Jackie.
Would you like to just tell us about yourself and your position as the CEO of St. A?
Sure. Well, I was born and raised in Milwaukee, and in fact received my master's in social work from UW-Milwaukee. And then I worked in the field for about 20 years in Minnesota and returned to Milwaukee to be closer to family, friends, in 2001 to be the CEO of St. A. So I've been there for 13 years and really enjoy it. Work very closely with our board of directors and our executive team to determine the direction and vision of our organization.
Well, can you also give us a brief overview of St. A and its mission and some of the services that are offered?
Sure. Well, St. A has been around a very long time, since 1850. So we'll be celebrating our 165th year next year. And both St. Emilion and Lakeside, the previous names, were orphanages. And then they evolved and adapted over the time, just like the community needs change, so did our services. And we now have a number of services that fall into education, mental health, and foster care services. We have about 500 staff that serve 5,000 people each and every day. And in particular, about 7 years ago, our board of directors was very interested and curious and concerned about youth aging out of foster care, and really believed that we needed to do something about that. So we now have a variety of programs that serve youth who age out of foster care in regards to providing case management and housing.
Now, for a youth that is in foster care, what happens when they turn 18?
Well, when they turn 18, even though they've been in the system perhaps for a couple years, we basically complete their service. So at 18, it's somewhat abrupt compared to what perhaps our own children have experienced, where it's much more gradual, and they really lose the social and economic supports that any normal child would have, because at 18 they are done receiving care in the child welfare system.
About how many youth does this happen to yearly in the state of Wisconsin?
Well, each year on an annual basis, between 400 and 500 youth age out of foster care. And in addition to that, there's the youth who may be now 19 or 20, so a number of kids may be between that 18 and 25-year-old age range.
Now, what are some of the additional challenges that they face when they age out?
Well, we know from research and data that it's really quite sobering what happens to kids who age out of foster care without the right supports. Over half of them experience some kind of homelessness between that time and the age of 25. About 30% of them may become imprisoned, especially Black males. They often have children early, which adds to the complexity and challenges of trying to navigate that adulthood. They also have low employment rates and have difficulty managing just the day-to-day skills and relationships that are required during that time.
So do many of them then lack a support system?
They really do. So oftentimes they don't have permanent support systems, those people that you go to when things aren't going well, to help you figure out those nuances of life as an adult.
Now, why is additional help needed for these youth to adjust to life outside of foster care?
Well, many of them who already experience abuse or neglect, so they're in the system, what we call the child welfare system, because of their family situation. And so many of them are struggling with some behavioral and emotional problems. They most likely experience trauma as a child and are really going to have difficulty managing that transition to adulthood.
Now, what services are they most in need of?
Well, they need it all. Anything that your child would need in that age range, this young adult would need too. So they need help finding jobs and getting mentored to find the right job and know what behavior is expected of them to be a good employee. They need help finding housing and the appropriate roommates and how to set up a house. They need help with furthering their education if they want to go back to school or even finish their GED or high school education, because many of them turn 18 without that. So there's all kinds of things that they need in terms of support to be able to be successful.
Do a lot of the youth lack basic life skills?
They do. They just haven't had the opportunity to explore and experience some of the things that most teenagers do. For example, most of them would not have a driver's license even when they turn 18 and age out. So they're kind of starting with a lot less than what most kids are starting with at age 18.
Now, without help, will the cycle of dysfunction likely continue?
Yeah, I would say they really need the services to be successful and to be able to thrive. And we are in particular interested in the young adults who have children also. So we've been able to work in partnership with Alliance for Infant Mental Health, and we provide a program to those young parents, in particular mothers, so that they learn how to interact with their children so they won't repeat that potential cycle of poor parenting or not understanding how important those early childhood years are. So we really focus on that too.
Now, can you tell us what services would be available for youth that age out of foster care?
Well, we provide to them staff who in particular look at all of those areas that we talked about. And they really act as, in some ways, parents, mentors, aunts, uncles, whatever that young adult needs to connect with somebody who cares about them and who's really going to help them through those difficult times and understanding just the nuances of all these new things, new applications, how to figure out funding and all those details you need to know.
Now, when a youth is about to turn 18, is there some kind of plan that's put into place?
Well, we're always trying to work with them while they're in care, but there are many other priorities and focuses just to kind of regarding their day-to-day health and mental health. So we're interested in helping them plan, but once they're on their own, sometimes they think for a short period of time they can do it on their own. They don't really necessarily at that point in their life want to be part of the system, but they often come back and realize that they need additional support and help. So they're coming back and asking for that support and help, not only from our staff, but we really work to help them create a family of their own so that we connect them with other peers who are going through the same thing.
What about the need for adults that would be willing to mentor the youth?
We're also looking for people to help us, whether that be through mentoring, just a one-to-one relationship, or helping them potentially get a job, a first job or a second job, and learning what that's like to maintain employment so that they get on the right trajectory towards something more successful.
Do many of the youth have jobs before they turn 18 as far as working as a teenager?
They really don't. In fact, many of them have not experienced a job. And as I said, some of the challenges are related to driving and all those kinds of things that many other teenagers experience. So they're struggling to not even have that experience to get them started. And then they don't have the same kind of connections and network that many of the other kids would have at their disposal, so to speak. You know, many kids get their first job because somebody knows somebody, and they don't always have that.
Now, does St. A take donations of household items and hygiene items?
We do. We're very interested in whatever help somebody can offer to us, because we're often setting up an apartment for these young adults who haven't lived on their own before. And so we're looking for those kinds of products and items.
Okay. Now, have you seen lives changed as a result of the youth being able to receive that extra help and support they need?
Yes, absolutely, which is very rewarding. In fact, we just had a rally, which is our annual fundraiser, in particular for this service area. And two young ladies shared their stories about getting help from St. A. And both of them are doing extremely well. One has a child, and she talked about the staff person as her second mom. And she has housing now, and she has a job, and she's on the right track. And then the second young lady is graduating from college and is really doing well. So it's those kinds of stories that keep you going and wanting to help these young adults.
For a young adult that's about to age out of foster care, what recommendations would you give to them?
We certainly would encourage and welcome them to contact our organization. They can go online or they can call our number, and it's sainta.org, so they can go to our website and see what kind of services we have and connect with some of our staff to see what resources are available to them.
Do they generally then need, if they're going to age out of foster care, do they need a place to live then? I mean, what's the transition between living in foster care and having an apartment? How does that come about?
Well, that's where some of the challenge and difficulty is, because oftentimes they don't have the income, and even if they do have a job, it's not the kind of job that's going to pay for adequate housing. So that's the statistic I gave you regarding homelessness. That's really where that comes from, is that transition period is very difficult. They may try to live with family, friends, relatives. They may do some sofa surfing and then realize that they really need some extra assistance.
And as far as getting a job then too, what's the challenges for never having had a job and then trying to go out and apply when you maybe don't have a home address or anything?
Right, that makes it extra challenging that, oftentimes you need a cell phone, you need a permanent address, and if they're unstable in their housing situation, it's going to be very difficult for them to find a job. And if they don't have transportation, don't have their driver's license, can't afford a car, that limits them in terms of where they can work and how they get to work. So they have lots of challenges.
The services that St. A provides then will give the youth a cushion that they need, so to speak. Is that how it might be?
Yes, we're committed to work with those young adults until they're age 25. So it's not a short-term thing where they start a service and end a service. We're really committed to the relationship with that young adult. So they may feel like they need more support at some point in their life than another time. But we're committed to helping them find those resources and establish themselves so that they start saving money and they're able to function and be more independent, whether that's by going to school and having a part-time job or getting a job right away and then going back to school. But oftentimes we see that as the critical requirement for them to be successful and thrive. And it's good for everyone. It's good for the community to have healthy and thriving young adults to become our next employees.
Well, thank you so much, Teri.
Thank you, Jackie. I really appreciate you having us on.
We appreciate that you were willing to come and tell us about this.
Yes.
Very interesting. We've been speaking with Teri Zywicki. She is the CEO of St. A. Our issue has been youth, and our topic, helping youth who age out of foster care. Thank you very much for watching Public Report.